The way to prevent slipping rib, I mean, if you're super flexible, you may still have this problem, so you're always going to have to be careful. But the best way to prevent it is by learning to brace your core, which is not something we talk about a lot in yoga. Hi gang, Denise here, and this is Ask Denise, and today I'm talking about slipping rib syndrome. Now, you may know this by different names because it's called a whole bunch of different things, so I'll help you understand this. Have you ever had pretty intense pain at these kind of lower ribs in the front, or right about this level in the back? So it affects ribs 8, 9, 10 usually, and here's rib 8. This is 12, 11, 10, 9, 8. So these last few ribs are the ones most affected. And if you have a slipping rib in the front, they often call it costochondritis. So if you've ever had that diagnosis, so something would tear a little bit or break off of this cartilage, or you could have a separation between the bony part of the rib and the cartilaginous part of the rib. And then in the back, you see, come and see these little, where the ribs join onto the transverse processes. That's a really shallow little joint there. And that can actually subluxate. It kind of gets pulled out of position a little bit, gets torqued. So kind of like a bucket handle. So it could be kind of lifted, something like this. Okay, and it happens when, especially in leveraged twisting, but it also happens in lots of forward folding, or, well, in the back, it would be forward folding. If you have that slipped rib in the front, it would more likely be from pretty extreme back bending. Okay, and it's because, again, these are very shallow connections, and they're easily pulled on a little bit too strongly. Now, especially people who are very, very flexible are prone to this because their connective tissues are a bit softer and they have less fiber, which fiber makes your connective tissue really tough and strong and hard to break. So if you have less fiber and you're really bendy, then your tissues are just softer. And if you add that to practicing in a hot room, then you're going to even be more prone to this. So what we see a lot, I do anyways, is especially people in hot practices are going to pop those ribs in the back. They're going to get that torque on that joint. And you know, the other reasons it can happen too is from a fall or a car accident or something like that. So it does happen to other people, but in yoga, that's why it would happen. So, you know, you want to start thinking about being more active in your core. The way to prevent slipping rib, I mean, if you're super flexible, you may still have this problem, so you're always going to have to be careful. But the best way to prevent it is by learning to brace your core, which is not something we talk about a lot in yoga. So I'm going to help you understand that a little bit better. It's going to often feel, when you have this problem, when you actually slip the rib, it feels like it needs to stretch. And there probably are muscles that are really tightened around the area, and they may feel like they want to stretch, but stretching will not help this at all, okay? So I want to encourage you, resist that feeling that you want to stretch, okay? And instead, what you're going to need to do is give it some relative rest for a few days, because it usually does fix itself in a few days. I'll give you some ways of helping it to do that. So one of the ways you can help yourself, especially if it's the posterior rib slip that you're having, is by using resisted breathing. So you're going to use a table, coffee table, kitchen table, or a couple of blocks. Put yourself in a similar position to this. You could be sitting on a chair and doing it though. And you're going to breathe. Watch what happens to my spine as I do this. It'll be quite uncomfortable for you, but it's perfectly safe. I'm going to hold my pelvic floor and lower belly steady and then take a big breath. See, my back is lifting a little bit, and then as I exhale, I'm going to squeeze everything into my belly, and I'm going to let my spine go into just a little bit of flexion, and then I'm going to inhale, or extension. Inhale, and exhale. Okay, so I would do this every day while you're trying to recover from that slipped rib. Because when you slip the rib, even just breathing is going to be pretty uncomfortable, and you'll find that certain movements will be very uncomfortable. So, you know, if you can kind of mobilize the spine, that rib might be able to right itself, okay? So that's just one of the things. You might also decide to use a yoga tune-up ball, put it right above and below where you might feel that the rib has slipped. You can lie on it and do those breathing techniques that I was basically explaining here, or you could put the ball on a wall if that's a little less intense for you and that feels better. So again, use your own breathing. These are kind of resisted breathing techniques to help remobilize that rib back into place. And then you've got to start bracing your core. Okay, so in some of the things that are going to help you if you have the costochondritis in front or slip rib in front will be bracing your core. That's how you're going to fix that problem. So I'll show you one technique, and that would be lying on your back. I'm lying on a mic, so it's going to look a little bit weird, but just doing something like this. You see I'm keeping my abdominals engaged and strong, and I'm just doing this. I'm tucking my chin. I'm basically activating my whole superficial front line, and that's going to help with that anterior slipped rib. Okay, so something like this. Alternatively, you would work on your plank, pulling up, and I would recommend the hollow body plank. So you're overcorrecting a little bit, really getting your front body to engage. Up, 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 up like that. Okay, and then when you go back to practicing a little bit more normally, you want to make your twists active. So that's regardless of if you're sitting on the floor. Here's how I would make a twist active. I would actively take my body to where it can go. Spend a couple of breaths right here, and then maybe come into support. But I'm never, ever, ever going to use my arms to yank my body. I'm taking binds and stuff. If you actually bind, and it's not that I'm against binding, but if you're binding in your spine and your core is passive, you're going to be very vulnerable to this kind of injury. So if you are binding with arms, you've got to resist the bind. So it's fine to have a bind happening, but then you're using your own muscles still. Use your muscles. Don't be passive in a posture like that, because you're just leveraging your joints. And if you're a bendy person, your joints are, your tissue's a bit softer, it's easier to injure, and you probably know that. So, you know, don't exploit your joints that way. That's my advice to you. Of course, you can do whatever you want with your practice, but this is what I'm suggesting. We need to understand that the higher priority in the spine is stability, and then work on bracing our core and being active through our core in our postures. And then you can avoid this problem, because it really sucks. It really sucks to have slipped ribs. It's painful. It takes days to improve and recover. And you don't want to go there if you don't have to, okay? So thanks for joining me, guys. Put your comments and questions below. Thanks so much for being here, and I will see you next time. Bye for now.